Hello, this is the case of the normal vascular anatomic variant that has been well spotted by the doctor evaluating non-enhanced CT of the brain. That you can see doctor pointed out to a high density structure in the cerebellum on the left side and even suggested perhaps is a DVA and suggested confirmation with the MR. We performed MR investigation that has confirmed a tubular structure here on T1 without contrast with the branching vessels like caput medusa mostly described. And we have seen a low signal in this structure on the T2 weighted sequence and also on the flare sequence. We have on request performed the time of flight angiography that is in this situation set for the arterial fast flow in the vessels of circulus villisi that show as high signal structures, and what we can see is that there is no signs of high velocity flow in this tubular venous structure as we would suspect it. Here is also, by the way, a nice anatomical variant, which is also very common, that the right vertebral artery is dominant and the left is very tiny, you can see in the foramen, and the pica is most likely originating from basilarly posterior inferior cerebral artery. So the other anatomical variant that we see quite often is that you can see the posterior communicating artery is feeding directly the right posterior cerebral artery with the P1 segment that should be between the basilaris and the posterior cerebral artery is absent. On the other side, on the left side, you can see P1 and then continues to the posterior cerebral artery just like normal. And here the anterior communicating artery. So we had no arterial flow, just we expected, and then we also performed the contrast study that confirmed very clearly the caput medusa appearance that is quite typical of the venous branching structure, and then a thicker stem that is draining towards the tentorium cerebelli venous sinuses on the left side, and you can see it on all sequences. The most important sequence is this one, SWA imaging, susceptibility weighted imaging, that is very sensitive for hemosiderin hemorrhage deposits, and it also shows the vessels as black structures. So this is the original sequence, and this is the MIP, maximum intensity projection. It's basically the same sequence, but the slices are thicker, so what you see on the same image is more of the vessels. So those small tiny vessels that you see are venous cortical veins. You can see also arteries, and you can very well see the DVA that is showing no sign of hemorrhage. This is very important that we have no signs of hemorrhage in this area. So developmental venous anomaly has, as usually, not caused any hemorrhage. Other important thing is to check on the parenchyma sequences that show good anatomy on the parenchyma, that there is no substance loss, no old infractions that we don't see here, as well as on the flare sequence, no gliosis, no signs of such gliosis or infection on T2 weighted imaging. So confirming the finding on the CT of developmental venous anomaly, DVA, and we see such cases really very often, and they are just being reported as normal variant without clinical significance, as in this case. Okay, that's it for today. If you like my case presentations, you can consider reviewing the previous cases, liking and subscribing, and I will see you in the next one. Thanks for watching.